Hello, everyone. Welcome back to my Dentistry Tuesdays. And today's topic is dental abscesses and why it's an emergency. My name is Greg Chong. I've been practicing general dentistry for the last 25 years. I love dentistry. I love helping people, and I'm happy to share. Now, let's get into it. Dental abscesses are basically a sign of infection, and they can be very, very painful. If left untreated, it can cause serious health issues, and you can die from this. So this is one of the main reasons why we consider it an emergency. Dental abscesses are basically an immune response by your body against the bacteria. And when the infection gets bigger, pressure and pus within the jawbone gets more and more, and that leads to a lot of pain. This pressure can be so painful that my patients relate to me that they wish they can rip out their own tooth. The infection tries to spread and forms an abscess or bubble on the gums, but if it has no way to escape, basically it will start to spread to other places in the body, in my case, other spaces to the face, and that's why it can be deadly, because it can actually get infection into and drain into your brain. On the flip side, one of the good news about dental abscesses is when it forms that pimple or that bubble, it is trying to escape at that point in time. So there is a limiting factor. I call it nature's version of a pressure relief valve. A couple of dental conditions can lead to dental abscesses. The first that comes to mind is your nerve of your tooth dies and then needs a root canal. Basically, the bacteria that naturally live inside your tooth have now started an infection after the nerve dies and leads to this abscess formation. A second condition that can lead to an abscess we call a periodontal abscess is because of gum disease. It's resulting typically from poor hygiene. A lot of stuff is collecting underneath your gums. The bacteria are going crazy, and your body's mounting another immune response against that. Along those lines, if you went to the movies and had some popcorn, maybe a popcorn kernel snuck under the gums and you didn't know it, and that can lead to another abscess as well related to the gums. So how do I treat these dental abscesses? Basically, I would like to pop it and release the pressure and get rid of the pus. Sometimes I do scrape inside to kind of get that infected tissue out of there so your body can start to heal. I usually prescribe some antibiotics. Usually I start with something simple that's related to penicillin if the person's not allergic to it. If they are, then I switch it to an antibiotic called clindamycin. It's very, very powerful. It knocks out dental bugs really, really well. But the drawback is it guaranteed causes diarrhea. So dental abscesses are pretty serious, and that's why they're emergencies. So please call your dental provider if you have one or suspect you have one. They'll get you in and get you treated. Thank you so much for joining me on my Dentistry Tuesdays. I appreciate it very much. If you have a question regarding this topic, please leave me a note in the comments. I'd be happy to get back to you. Also, if you have another topic you wish me to discuss and make, please leave me a comment as well. Again, I appreciate you being here. Thanks so very, very much. And everyone have a great day. Thanks, and bye-bye.